Today on the show, we're joined by Dr. Shannon McDonald, who is the Acting Chief Medical Officer at First Nations Health Authority. And we're here to talk about vaccines. There are a lot of people who are a little bit hesitant to get their vaccine, but we're trying to make it to herd immunity. So glad we could have you on to just kind of explain the really important reasons why we should all be getting our vaccine. So welcome, Dr. McDonald.
I'm happy to be here.
Yeah. So these vaccines, I know a lot of people are really hesitant. They're saying, well, they were developed so quickly. How can we be sure they're actually safe?
Okay. So it sounds like, gee, magically we knew about COVID in December and we had vaccines in January or whatever. But that's actually not the case. The science behind it, the technology behind these kinds of vaccines have been around for 10 years. And they have been used to develop vaccines for rabies, for example. They were involved in the development of vaccines for Ebola virus and other really dangerous virus diseases. So the technology already existed. As soon as we knew internationally that there was a new virus that could cause a real problem, including serious illness and death, work began all over the world for the development of vaccines. As soon as they were developed, there was potential vaccines developed. Scientists again, and physicians and epidemiologists and other specialists all over the world started working on testing these vaccines, testing them on humans, making sure that nobody was having horrible side effects and that they were safe. Canada has one of the most strict testing regimens in place and approval regimens in place. So we know that the vaccines that have been approved for use in Canada are incredibly safe. And we've also seen there's been more than 1.5 billion, with a B, people across the world who have received one of several different vaccines that have been developed. And the rate of serious side effects has been very, very, very low. So we know from experience, we know from having experience with the science and having experience with distributing and putting vaccine into people's arms and seeing what happens. We also know that the rate of COVID infections has come down phenomenally once we began the vaccine program.
So it isn't just like they're experimenting on us right now. This isn't just a thing that they sprung on us.
Correct. And I think one of the things when people talk to me about that is reminding them that if it's an experiment on 1.5 billion people. So it isn't targeted in any way, though we are continuing to track how effective the vaccine is, how many people have adverse side effects, and watching to see how long the vaccine lasts in our system to provide protection. So in some ways, there is continuing research being done, but it's being done to be sure that the vaccines are available, effective, and safe.
So you kind of mentioned it in your last answer, but how long is the COVID vaccine effective? Or do you think we're going to have booster shots down the line, like other types of shots that we've had previously?
Actually, we don't know for sure. Because the vaccine hasn't been around very long, we put the first vaccines into arms into BC First Nations on December 28th last year. So we've only had 7 months worth of experience with the vaccine. So far, the vaccine is not only maintaining a level of efficacy, it's actually increasing in its effectiveness over time. So we don't know if there's going to be point at which that starts decreasing. And there's constant monitoring, blood work being done, and people are being tested to see if that period of time when it's less effective happens. If that does happen, or if variants of concern, and we'll talk about that, I'm sure, if variants of concern come that escape the power of the vaccine, for whom the vaccine is not as effective, then there may need to be booster shots available, but right now they are a conversation. There's no reality to it.
And if people want to travel outside the province or the country, am I going to need to be vaccinated, or are people going to need to be doubly vaccinated to do anything like that?
The rules are different depending on where you go. So in a couple of weeks, I'm going to Winnipeg. I live near Victoria on Sayut First Nation, but I have a new grandchild who's going to be born in Winnipeg. And we're very excited because the rules for a long time this year were that if you went to visit anybody in Manitoba, you had to quarantine for 2 weeks and then you could see them. That's gone now. So we don't have to do that. We are doubly vaccinated and we have proof of that, the cards we were given. And there's also an application that you can get through your BC Services card that says, I've already had 2 vaccines. I've actually had COVID too, in between those 2 vaccines. So no matter what the rules are going forward, I'm fine. Now, in some cases, people may want to go to other places. So right now, the United States is limiting non-essential travel across their border until at least August 21st. So that's not a possibility for most people right now. And other countries have different rules. So right now there's a bunch of work being done internationally to make decisions about what vaccines, because there's been different vaccines used across the world, which vaccines make the country you're visiting comfortable. So I've had 2 doses of the Pfizer vaccine. If I decide I'm going to go to Italy, does Italy decide that that's an okay thing for entry into their country? So my best advice to people is to make sure that they ask good questions about where you're going and what the rules are in that particular location. There are some different rules. In France right now, for example, they have developed what they're calling the green card, the carte verte, and it confirms that people have been doubly vaccinated. And you need that now in France to go to a theater, to go to a restaurant, to go to a cafe. They have very strict rules about people having sufficient vaccination. That isn't the case everywhere. So it really is a matter of doing your homework, knowing where you're going, and finding out what the rules are when you get there.
And I know that it's summertime right now, but once fall hits, it's going to be coming up on flu season, and a lot of people are choosing to get their flu vaccines. Is there any kind of reason why we wouldn't be able to get the COVID vaccine around the same time as a flu vaccine or any kind of other vaccines?
Well, one of the things is that we have to kind of give our immune system a break. So what we tell people is that if you're going to get one vaccine, either COVID or the flu, give it about a 2-week spread in between so that your body has an opportunity to respond to both. The other thing about a flu vaccine, absolutely recommended. Last year, when everybody was washing their hands and being really cautious about distancing and wearing masks, we had almost no influenza detected in BC, almost none. So what that tells me is that not only is vaccine effective, but the behavior, the public health behavior that we all followed was also very effective in protecting people against any kind of respiratory viruses. And COVID is much the same. As much as we'd like to think we've beaten it and it's gone, it's not going anywhere. We're going to have COVID around forever. It probably will eventually be like those seasonal flu vaccines. If you have been vaccinated against COVID, we're hoping that it's a long-lasting protection against COVID. But for those who choose or are not able to have a COVID vaccine for different reasons, they will continue to be at risk of COVID infection forever. So even those of us who are doubly protected need to be cautious about our behavior in public so that we're not at risk of getting serious disease or dying, but we want to make sure we're also not transmitting, unknowingly transmitting infection to people that we know and care about.
And we kind of talked a little bit about the different kinds of vaccines. You were talking about Pfizer, but what can you tell us about the different types of vaccines? Why are there different types of vaccines?
Well, when we first found out about COVID, there were more than 150 different science labs across the world who were trying to find the immunization for COVID. And several of them were effective in creating something, but they were slightly different. So, for example, two of the vaccines that we use specifically in BC, the Moderna vaccine and the Pfizer vaccine, are what's called mRNA or messenger RNA vaccines. And what that means is that it's like a recipe card. It is taken from the virus, and then a kind of a carbon copy is made so that it can be put into the vaccine and given to you, but your body doesn't recognize it. It becomes a recipe card for your body. I'm going to back up. What we're trying to do is recreate, have you ever seen the pictures of the coronavirus where it's got a bunch of spikes? It reminds me of what we used to make for Christmas decorations when we were kids, where we put push pins into a styrofoam ball and spray painted it. That's kind of what it looks like. So those spikes, the things that are on the outside of the virus, are the thing that's most identifiable about COVID. So the messenger RNA gives us a recipe to build those in our body. It doesn't build a complete virus, and it doesn't have DNA in it. It's just a recipe for our body to create a defense against this spike protein, because our body recognizes it as strange, not part of ourselves, and builds an immunity against it, so that when we do come into contact with the COVID virus, it goes, hey, I know them. They're the enemy. We know how to attack it. We have the tools. Let's go. So that's how an mRNA vaccine works. And both Moderna and Pfizer are mRNA vaccines. The other one that's been used in BC is AstraZeneca, and it is a viral vector vaccine. So what happens is that, like the measles vaccine and other vaccines, the virus itself is attacked in the lab so that it's dead. It can't infect anyone, but it still has all the parts, right? It still has those spike proteins. So your body builds a resistance against the spike proteins. So it's a slightly different technology by different companies, but both very, very effective ways for your body to build immunity.
And there's a lot of talk about the Delta variant because these viruses do mutate. Will the vaccine still work if the virus does mutate?
Virus is like a teenage girl. I use this analogy all the time. It keeps changing its clothes to be more popular, right? So what the virus is doing is saying, I don't have the DNA to replicate myself. I can't make more virus by myself. I need a human host. I need to use their DNA to make more of me. So it is mutating with the attempt to be more transmissible, so easier to spread around, and to make me sicker so that I'm coughing and spewing and doing all those things that cause the virus to be spread. And right now, our vaccines were never designed to keep you 100% free from COVID. What they were designed for was to keep you from becoming seriously ill, ending up in hospital, and ultimately being at risk of dying of COVID. So we know right now that people that have 2 doses of the vaccine have good protection against all of the variants and concern that we have active in BC right now. For people who have had only 1 dose, they have less protection. So the Delta variant specifically, less protected against that if you've only had 1 dose. And that comes from evidence from Europe. So we know that that second vaccine is really, really important to be able to battle the variants. There are new variants coming. And it's just like every year we get a different flu shot, and we base the flu shot on what happened in Australia during their winter, basically. But sometimes we get it wrong, and some flu virus, basically a variant or a mutant, will slip through and make people sick. But most of the time we can predict what variants are going to be around, and we use that to build our flu vaccine. And it's the same thing with COVID. If we start getting new variants that come in that we're not protected against, that's when things like a booster may be developed.
And when do you think the community will be herd immune? When do you think we'll get herd immunity through vaccines?
You know, it's really funny. We use the term community immunity because I don't like thinking myself as a part of a herd. Different numbers get thrown out there. At first we kind of said, oh, it's 70%, and then it was 80%. And in some communities now they're saying, no, you need 90% of people to be vaccinated. And what that does is prevent the ability of the virus to be transmitted within the community if there's less people around who are vulnerable. However, none of us, or very few of us, live in communities that are completely locked in. If you had 90% of the people in the community vaccinated and never went out and nobody else came in, you probably could create a community immunity in that circumstance, but that's not the reality for most of us. You know, I live on a small reserve 20 minutes from Victoria, but I go to the grocery store and I go to the bank and I may take my dogs to the beach. And there's people there. So there's always a risk of me being somewhere where the vaccine is not being sufficiently protective, and then unknowingly bring it back to the community to people who may not have the vaccination status that I do.
And when do you think that kids under 12 are going to be eligible to get their vaccines?
Right now, the work is being done and studies are being done to make sure that it's safe and effective for kids under 12, to make sure that we get the dosage right. How much vaccine do we need to give them to protect them? Because a 5-year-old is not the same as a 17-year-old or as a 47-year-old. So that work needs to be done and is ongoing. We're hoping that we will see enough effectiveness data available by the fall from these studies for Health Canada and the National Vaccine Advisory Committee to be able to take a look at, to make recommendations about its use. It's like right now we only have Pfizer that's available for 12 to 17-year-olds in Canada, and we've been waiting to hear that Moderna had been similarly approved for vaccination in that age group. Once the scientific evidence is there and the risk of adverse events have been investigated, that's when those approvals will come in. We really hope that it'll be available by the time the kids go back to school in the fall.
There's a lot of people who have to take medication, whether it just be, an anti-inflammatory aspirin every day or vitamins. Do you need to stop taking that kind of stuff before you have your COVID vaccine appointment?
Generally, no. Most things that you get over the counter at the drugstore, it's fine to continue that, or even your regular prescribed medications. The people we get concerned about are the people who are on medications that may change their body's ability to mount an immune response. So people who are on cancer treatment, for example, some people who have autoimmune disorders or multiple sclerosis or some other pretty significant diseases. And we always recommend, because I don't know of all the people who might ask me, is it okay? I don't know enough about their history to be able to make a good recommendation. So we always tell people that if they're concerned or they're not sure, to check with their healthcare provider. But for the most part, regular over-the-counter, take a Tylenol for a headache, it's not going to change your body's response to the vaccine.
And you just touched on it, but I just want to reiterate, for anybody that does have pre-existing health conditions or concerning things in their medical history, should they be going to their doctor ahead of getting the vaccine?
Well, you should at least have a phone call. Nowadays, getting in to see the doctor is a challenge. Not all doctors are back to full practice in their offices. But if you are on any medication that you think might be changing the way your body would respond to a vaccine, it's worth the phone call.
And finally, before I let you go, I know that you are doubly vaccinated. So what was your personal reason? What was the main reason why you wanted to get fully vaccinated and do this?
Both my husband and I have chronic health conditions. And so we knew that we were at particular risk of a serious case of COVID. But I also have children, adult children, and I have grandchildren, including very little ones, one that's not quite born yet. And we wanted to be able to travel to go see those children. It's been 2 years since I saw one grandson, and that's not okay. We go to Mexico every year in February. We didn't get to go last year because of COVID, and I'd really like to be able to travel again. So to be able to maintain the life I want in good health and raring to go, I wanted to make sure that I have vaccine. Now, I'm one of the unlucky ones. I had my first vaccine and 19 days later was diagnosed with COVID. So we know that there's always a risk even after a first dose. But I had a relatively mild case, and other than having to hang out in the house with my husband for 2 weeks solid and listen, have conversations every day with public health, it wasn't a horrible case of COVID. And so I'm very blessed and was very glad to have the opportunity to get my second dose of vaccine.
And before we wrap things up here, Dr. McDonald, is there anything you want to leave us with?
Vaccines work. Take care of yourself and take care of your family and friends and your community.